Hey friends, welcome to AJ Maths. In this video, I am emphasizing on the ABG compensation rules. To begin with, I'm not going to discuss the pathophysiology or any details of the ABG imbalances in this video. For that, I will be having another video. What I'm doing here is just giving you simple rules, and in last the picture you may have a screenshot to keep in your mobile all the time so that you start applying these rules while doing the questions or while rounding in the wards, so that you better start appreciating the disease processes which are happening both in the respiratory and the metabolic imbalances. Okay, so the basic is Winter's formula. We have time and again heard of this formula, and we most of the time are able to apply this formula with near accuracy. So to better memorize and have a better understanding of how to apply these rules, I am not starting with the Winter's formula. I will take a retrospective approach, a reverse approach, and I will starting with the respiratory disorders. Okay, the rules we use are the Boston methods. Okay, so I would want you to write acute respiratory acidosis, acute respiratory alkalosis, then we have chronic respiratory acidosis, and then we have chronic respiratory alkalosis. Okay, now it's simple afterwards. We have CO2, obviously, partial pressure, and we have changes in the bicarbonate. Okay, simple so far. Now I would want you to remember it like this way. The increase in the partial pressure of CO2 in the acute respiratory acidosis of 10 millimeter mercury will rise your bicarbonate by 1 millimole per liter. Okay. In the respiratory acidosis, it will be decrease of 10 millimeter mercury of the carbon dioxide partial pressure, and it will be a fall of 2 millimole per liter of the bicarbonate. In the chronic respiratory acidosis, we have 10 millimeter increase in PaCO2. This will give me the compensation by increasing bicarbonate by 4. Okay, 4. And when I come to the chronic respiratory alkalosis, it will decrease in the 10 millimeter mercury of the carbon dioxide will decrease your bicarbonate by 5 millimole per liter. Like, simple to remember, right? We have 1, 2, 4, and 5. These figures you just need to remember. Okay. After this, I will come to the metabolic imbalances. Metabolic imbalances. Here we have acidosis. And I spoke earlier, we go to the Winter's formula now. It's easy, right? For a complete compensation, expected PaCO2 will be equal to equation, and equation is this: the bicarbonate concentration plus 8. And for the alkalosis, the equation is like the complete compensation, the expected PaCO2 will be 0.7 into bicarbonate plus 20. You can remember like this: it's 0.1, it's 1.5, and half of this is air. 0.7 and 8, approximately double. It's just a way to remember. The more you practice, the more acquainted you will get to this equation of the alkalosis. Okay. The one more important thing is that the bicarbonate used in these equations is the actual bicarbonate as calculated from the PCO2 and the pH using the Henderson-Hasselbalch equation. And the baseline bicarbonate volume is assumed to be 24 millimole. Baseline bicarbonate value we are taking to be 24 millimole per liter, and the baseline normal PaCO2 like 40 millimeter mercury. Obviously there's a range, but to solve the questions, that's enough for you. Okay. There is one more thing I would like you to remember is that the bicarbonate has dropped significantly more than the gap has elevated. Okay. When the drop in bicarbonate is significantly more than the gap has elevated. A gap means the anion gap is elevated. At this point of time, you would think that there is normal non-anion gap metabolic acidosis coexistence with anion gap metabolic acidosis. Okay, these are some of the rules to remember while you are seeing the ABG arterial blood gas analysis, which is drawn from the arterial sample. Then besides this, we have something called the urine anion gap, which is used in the normal anion gap acidosis. For this, I will be talking in the detailed video on the metabolic acidosis. Okay, friends, so to revisit, these are formulas. These are the compensations for the respiratory disorders in the acute and the chronic settings. I've written both acidosis and the alkalosis, and here we have the metabolic ones. Okay, and then we have something how to see if there is coexisting normal anion gap metabolic acidosis with the anion gap metabolic acidosis. Hopefully, this will help you to memorize the compensation rules and make you more acquainted to use these equations and have a better approach to read and understand and interpret the ABG of the patients or in the questions.